Fatty liver is a very vague term. Now there are many different terms in the market, but fatty liver is very normal issues and common issues in the Indian society. So the main cause of fatty liver is obesity. A person who are obese, whose BMI is high, and the patients and the person who is diabetic, so they are very much keen to develop fatty liver. There is strong link between diabetes and fatty liver because in the uh, pathophysiology of diabetes, we see that diabetes causes insulin resistance in the body. So glucose metabolism get affected due to the diabetes. So there is more glucose and fat storage increase in the liver. So that causes more fatty liver in the diabetes patients. And there are many causes. The prime cause of fatty liver is diabetes, and the second one is obesity, which is the major causes. And various patients who develop cardiac disease or uh, even now hypertension also. So there are all the metabolic causes, increased cholesterol level, increased lipid levels, these sedentary lifestyles, smoking, these all are the passive, or say even a small alcohol drink, high sugar intake. These all are things which causes fatty liver in our body. Less of exercise, more of sedentary lifestyle, more of volume, not doing excessive works, sitting on a computer, doing only computer work, computer work, computer work. So it all causes fatty liver. Sugar is the basically, I must say, main component to develop fatty liver because if we take more sugar, then the body metabolism affected. It causes more of a lipid or fat store in our liver, and a lot more sugar intake causes more of insulin release. Sometimes obesity causes insulin resistance in the body, which causes these fatty livers. Dark pigmentation or the eye, or I will say xanthelasma around the eye or at the neck. We see many of the in the patient, which causes it, which is a main indicator of insulin resistance in our body and increased cholesterol level in our body. So these are the factor which have to be keep on in mind to think about the fatty liver because if the body has insulin resistance or increased fat in the body, definitely it causes fatty liver. Fatty liver per se has no symptom. It is all of a it is a metabolic disorder. The background disease is a background condition which causes fatty liver, which causes main symptoms like diabetes or obesity. Sometimes these cause hepatitis, it is called steatohepatitis. Then there is increased level of liver markers, parameters, then the LFT we see. So we have to be very much, to in our mind to see our daily LFT. Once a month LFTs to see the SGOT at PT level. So there are many conditions which causes fatty liver. So even the patient of fatty liver causes obesity, bloating, or they causes excessive sometimes fatigue also is there due to diabetes or fatty liver. So they have to be very sometimes excessive, increase in liver size, sometimes for pain abdomen also. So these are the things which has to be kept in mind for fatty liver. There are condition in which the NAFLD, the non-alcohol fatty liver disease or MAFLD, develop MASH, hepatitis, then it leads to cirrhosis. These are the these are the sequelae to each other. First, there is fat stored in our body, then it's called as fatty liver, then there is swelling, edema, or inflammation in the liver, and then there is cirrhosis. So they are all interconnected to each other. That liver healthy is the most important things in modern era. We have to keep our liver very healthy by eating good food, good meal, less oily food, less sugar intake. We have to keep in our mind about diabetes. We have to control our diabetes, to check our diabetes. Our lipid levels should be adequate. Our hypertension level, cardiac level, all has to be very much maintained. And obesity, fat in our body has to be stored, has to be less. So BMI should be less than 25. So we have to keep that in our mind. No daily exercise, which is mandatory for our body. No belly fat. We have to avoid belly fat. Exactly, black coffee. I must say, black coffee is very good for liver. There are many articles also which tell us that black coffee is good for the liver. So it is not the milk coffee; it is black coffee, which is good. Milk, black coffee with no sugar help us in fatty liver. Definitely, it could increase the BMI, it decrease the adipose in our body, so it is good. There are certain drugs in the market also. New drugs are coming, and treatment is decrease your belly, and correct your blood sugar. These are the main thing. Avoid fatty foods, avoid junk food, eat more of a homemade food, avoid oil, avoid sugars. That's it. And eat black coffee. Nowadays new concept is coming, good fat or bad fat. Uh, we will not go into that, but my point is that if the patient is belly, if the belly fat is there, then that fat going to hamper your liver. So just avoid your belly fat. Be healthy. Do yoga. Do exercise on daily basis. Drink black coffee and just take care of your liver. Very important.